Good afternoon. Today we are announcing 102 new cases in Harris County outside the city of Houston. In total, we have 15,552 cases in the city of Houston and Harris County and 267 deaths. I want the reopening to be successful. I want the economy to be resilient, but I'm growing increasingly concerned that we may be approaching the precipice of a disaster. And if we get to that precipice of a disaster, we will not be in a position to reopen successfully. This week, the COVID-19 general hospital population in Harris County was the highest it has ever been. It was the highest on Monday, and it's gotten worse every day. We've seen increasing trends in COVID hospital and ICU populations over the past 2 weeks that are all statistically significant. I've always been concerned about reopening too quickly, us moving too fast, and we're seeing the impacts of that now. You can see the hospital population started climbing 2 weeks around after the phase 1 reopening. Now, I do want to be clear, there is plenty of ICU and hospital capacity right now in our hospital systems, and we're working very closely with our partners to monitor that. However, if the trends we're seeing right now get worse or continue to rise, we are at a very high risk of getting to the point where the threat to our hospital system is severe and we have to backtrack. We hope this trend will stop, but we have to recognize that since that initial increase after the first phase of reopening, we've only had more and more reopening phase 2, then Memorial Day, and then even more contacts. So perhaps it's unlikely to expect things to change unless we all change our behavior, take personal responsibility to keep our county and our metrics from continuing to head in a dangerous direction. We need to focus on the future right now, on taking control of this, and that's in your hands. We all want to get back to work, we want to see all our friends, we want to hug our family, go out to eat, resume our livelihoods without limitations, but we still have a long road ahead of us to end this epidemic, and we have to accept that life as usual probably will not be returning anytime soon. If we want to avoid a crisis in our county, in our community, we've got to accept that. The only way out of this crisis is for the community to work together so we can avoid further uncontrolled transmission and we can be in a position to reopen our economy sustainably and successfully. We're doing our part at the county, but we can't do it alone, and that's why today we are announcing the Harris County COVID-19 threat level system. And Mayor, I'm so glad to be here with you. Thank you so much for all your leadership and your partnership of your team with ours. The system does 3 things. First, it's clearer than what we've had so far. We owe it to our residents to have consistent and very clear data-based information to keep them healthy and safe. So this system is designed to break through the noise and help residents understand what the threat is and what action they should take. Number 2, it's a system built to last. It's a long-term solution. Harsh truth is, COVID-19 is going to be with us for a while until we have a vaccine, a treatment that is widely available, and we don't have that right now. And so this will live on beyond any temporary order or executive order. And finally, this eliminates the system of lurching from one order to the next. Even as we've had additional executive orders from the state, our guidance to the public has remained constant, and I want to make sure that that guidance breaks through. So today we're announcing that we are at level 2, orange. That is significant threat in our community, and the guidance is for folks to minimize all contacts. Level 2 signifies that there's significant Not severe, that's level 1, but there is significant and uncontrolled level of COVID-19, meaning that there's ongoing transmission and that we don't have evidence that the public health measures we have in place are being able to limit that community transmission. Despite our best efforts, and Harris County, the city of Houston, have been driving to meet demand on testing and on tracing. And we're meeting that demand, but we still have uncontrolled spread. So that tells us that the level of transmission in the community is going too quickly and too uncontrolled a way for these systems to keep up. At this level, residents should minimize contact with others. They should avoid medium or large gatherings. You should not, as I've been saying, go to bars or clubs or other places where you're exposed to others in close contact or you're with large groups of people. Let me be clear. Regardless of level, folks should continue the use of social distancing, frequent hand washing, use of face coverings, and if you feel sick, trying to quarantine for 14 days, getting tested. The other levels are level 1, which is severe threat, and that is red, Level 3, which is moderate threat, that is yellow, and the recommendation is for folks to stay vigilant. And level 4, which is minimal threat, it's green, and the recommendation there is to resume normal contacts. At that point, we would be able to have a vaccine, a treatment, or to know that we can break the chain of transmission as soon as it arises. So we have a new case, we know where it came from, and we can cut the virus off right at its source. As I said, there is sufficient capacity right now at our hospitals to deal with the rise in admissions. But should that change, the county stands ready to deploy our medical shelter of last resort at NRG. I also want to note that 100% of costs associated with that shelter will be paid with FEMA or CARES Act funding. That means no draw from our county budget. As long as I'm county judge, we will fight for every federal dollar made available to protect our community from this deadly virus. I do want to thank our federal partners, FEMA Region 6 Administrator, our state partners, and our congressional delegation in all of their support throughout this emergency and helping make sure that Harris County dollars are protected at a time of great need and great economic strain. We are the 3rd largest county in America. We are the epicenter of this COVID outbreak in Texas. We will always err on the side of action, on the side of information, and on the side of transparency. And our job is to tell people the truth. My philosophy has been to move fast and early and proactively in addressing this crisis, and that's why I'm standing here, not to scare people, but to give folks the information they need about where we are right now, because we need the community to take personal responsibility and work with us if we want to avoid a crisis. So let me stop right there. Mayor Turner will give his remarks, and then I'll return and repeat my remarks in Spanish before we hear from Dr. Shah and Dr. Persse. Thank you so much. Mayor Turner.
Thank you, Judge, and it's good to be with you today, and certainly want to thank you for your leadership throughout these several challenges that we face this year. And then it's good to be with State Representative Amanda Wally, the Chief Recovery Officer for Harris County, working directly with Marvin Odom, the Chief Recovery Officer for the city. Dr. Persse, Dr. Shah, Director Williams, and good to be with them. Let me just reiterate some of the things that Judge Hidalgo said. Going back to March, when we started down this road, and we asked people to work collectively to stymie the progression of this virus, and a number of things closed down, and we suspended service on many things. And then in April, we saw signs that we were blunting the progression of this virus. In fact, towards the end of April, we said, and you all were reporting, and people were hearing, that we had flattened the curve. Didn't mean that we had abolished the virus, but we had flattened the curve. and we were starting to see some good results. People were wearing their masks, engaged in social distancing. The number of people heading to our hospitals were going down. The number of people being in our ICU beds were going down. And so the numbers were looking quite favorable. And then when you looked at our numbers and compared them to other jurisdictions in the country, our numbers in Houston and Harris County were quite good, you know. And so where we are today, things started opening up as of the last week in April, first week in March, and 2 weeks pretty much after the fact. We're now seeing that the number of cases are going up, and it's being reported all over, not just within this region, but within the state, and the numbers are going up. I would say today we're reporting 210 new cases in the city of Houston, 210. And I suspect, in talking to Dr. Persse, because of the cases that are being reported, the numbers will be high probably tomorrow as well, but 210 cases. The good news is that we're not reporting any deaths, and so the number of people who have died inside the city of Houston remains at 146, but 210 new cases that are being reported, and the numbers continue to tick up. Let me just say, and one of the reasons why I wanted to be here with Judge Hidalgo and the county is to say it remains even now more important for people to mask up, put on their mask, especially when they're in a crowd or with other individuals. As we start to re-socialize, so to speak, it is just so important to mask up. More important now than even before. And people should not take things lightly or assume that the virus is under control. As Judge Hidalgo said, the virus is not under control. The community spread is not under control. And as more people get out, move about, get close to one another, we fully anticipate the numbers to go up unless people take certain steps, and that is putting on their masks, still engaging in social distancing, proper hygiene, washing their hands, the sanitizers, all of those things that work to flatten the curve back in April are going to be needed to flatten the curve again where we are now. Things are going to get even. More and more cases will come, and we will see that in the numbers. So let me just urge people to be mindful of the things that they need to do to protect themselves, to protect their seniors, people with underlying medical conditions. But in the last week or so, you know, we've reported people who have died in their 30s, for example, with no underlying medical conditions. So this is just a reminder, with so much having taken place over the last several weeks, and that there are many people who may feel as though this virus is yesterday's news. This is just a reminder that the virus is still here, and if we want a decent fall, so to speak, a lot will be determined by what we do now and through the course of the summer. So please mask up, you know. Get you something that goes with your outfit. This one doesn't go with my outfit, but this one does, you know. So just govern yourselves accordingly. Otherwise, we'll get to the position where the spread will exceed our hospital capabilities, and we will find ourselves in deep trouble. So as we say, govern yourselves accordingly. Be mindful, get the information, take full advantage of what the county has put forth with this is level number 2. Certainly don't want to get to level number 1, but whether or not we get to level number 1 will depend on what we do right now. So mask up and protect yourself. Thank you, Judge.
We will now hear from Dr. Shah and then Dr. Persse.
Thank you, Judge. Thank you for your leadership. Thank you, Mayor, for your continued leadership as well. Representative Wally, thank you as well. And Dr. Persse, always a pleasure to be with you. And I also want to recognize Director Williams from Houston Health Department. My name is Dr. Umair Shah, the Executive Director of Harris County Public Health and Local Health Authority for Harris County. And I want to just start by saying that we may be tired of this virus, but this virus is not tired of us. And I think that is a key message here, as the judge has outlined and the mayor has underscored, that this virus continues to be with us. This gauge allows for an easier to understand way for our community to know where we are in the coming weeks and months of this pandemic, and really what kinds of activities really are going to allow for protection of those individuals, their families, their loved ones, and ultimately our broader community. I think it's absolutely critical that as we work together, we have to remind ourselves that this pandemic is not over. We are seeing blue skies outside, it's 90 degrees outside, it's summer, and we know all sorts of activities are happening. As those activities occur and as we resume what's happening in our communities with the state's plan to reopen, we are concerned from the public health standpoint what we are seeing in our healthcare system. Yes, we are seeing increased cases that we're identifying in the community due to testing, but as we've all said, that testing has been a challenge throughout, and getting those results back or potential delays in lab results from the community testing means that it's very difficult at times to look at just one measure. That's why we're looking at a number of different indicators that go into this gauge, including what's behind us, the healthcare system and what's happening in the hospitals, particularly in the beds and the ICU beds. And the judge has made it very clear that we have ample capacity right now in the healthcare system. That's as a system as a whole. We do know that certain hospitals are having challenges, including at Harris Health System, our LBJ Hospital and our Ben Taub Hospital. But I will say that this is a reminder to the community that we are in orange right now. It may feel like we're in green, but we're not. And we want everybody to take all the precautions they can so that they can protect themselves, again, their family members, and certainly their broader community members, and that's all of us. The other thing that I wanted to say is that as we think about where we are and how we've gotten to where we are, the judge and the mayor are absolutely right. We have done a fantastic job as a community to fight this virus, to fight this pandemic, and that's what's happened thus far, all the way up until the point over the last few weeks where reopening, what I'm calling is really layered risk, that reopening in different phases, in addition to that milestone events such as Mother's Day, Memorial Day weekend, other activities that may even seem small in some sense, graduations, etc., all of those layer upon what's happening, which means that people are out and about. We have additional transmission because of those activities. And unfortunately, we were hoping that we would not be back at the podium here to say that we are seeing increases in our healthcare system, but that's exactly what we are seeing right now. So I want to urge from a public health standpoint and a health department standpoint, all of our Harris County Public Health staff who have done an incredible job, and kudos to them for all the work that they've done, along with public health partners across the region, the state, and across the country. I will say that at the end of the day, we have to rely on you, our public, to help us. We can't do this alone. We've got to do this together. And ultimately, all those precautions we're talking about really is going to help you, help us protect this community. Again, we may be tired of this virus, but this virus is not tired of us. And with that, I'm going to turn it over to Dr. Persse.
Thank you, Dr. Shah. I'm Dr. Persse. I'm the local health authority for the City of Houston, and I'm also the EMS medical director for the City of Houston. And I also am board chair with SETRAC. And so I want to take a little bit of a deeper dive into the data to illustrate a couple of things. And so the graph behind me, as you can see, shows a steep rise. To my right, to your left, is another view of it. It's looking at the patients that are hospitalized in regular beds versus those that are hospitalized in ICU. And what you see is that most of this increase occurs or appears to be in general beds at this point. There is an increase in the ICU beds, and this is what we have seen before, is that very commonly patients are admitted to the hospital. They're in a general ward bed, and at the end of about a week or 10 days, they either get better enough they can go home, or they become more critically ill and they wind up in the intensive care unit. So the fact that we see this increase in the general beds more so than we're seeing in the ICU beds, is not in conflict. That is actually exactly what we would expect to see. The other thing I want to point out is that this increase in the cases goes back to about May 25th-ish. And so, as Dr. Shah was saying, and I want to repeat, is that this is, this is not one single event. There was no one single event that set this off. This is the reopening of society and people going out and engaging. Now, the good news is that I'm hearing from my colleagues in the hospital, good news or bad news, depending on how you want to look at it, but also the average age of the patients who are admitted to the hospital is getting to be younger. And this is for a variety of reasons, we believe. One is that while elder folks remain at highest risk for the most serious consequences, without nursing homes and the senior living centers and places like that, the City of Houston's Health Department, Harris County Health Department, with the city's health department, we actually engage with the Houston Fire Department, and we've been engaging with these types of facilities for some weeks now. The state has come in to assist with testing. We are also testing all of with the nursing homes. We're also testing the senior living centers, the assisted living centers. We're testing all those, coaching those folks, and it appears that that effort is being beneficial in as much as the average age of the folks that are becoming hospitalized is less so the elderly group. The bad news of that comment is that it's the younger folks that appear to be becoming hospitalized, and that is, again, consistent with the reopening of society and folks going out and behaving in ways that we really would recommend. Again, large groups, not wearing masks, not social distancing. This is difficult. We understand that, but we are also seeing the effect of that. And so now is the time for folks to change that direction. We talk about individuals with the wearing masks and the social distancing. I also want to remind employers that, from my standpoint, I look to the employers within the City of Houston, especially those with public-facing jobs. To the degree possible, I would strongly encourage you to require that your employees all wear masks. If for no other reason than to set a good example for the public. You can't make the public, you can't make your customers do it, but you can make your employees do it. It protects your employees, because if somebody comes in who's infected and they infected one employee, that employee, anyone who becomes infected, the people they are most likely to affect, again, the next person they're most likely to affect is going to be a family member or a coworker or a neighbor. So for the employers, if you want to protect your workforce, I would suggest that you have them wear their masks and follow all these rules. And then the final thing I want to talk about is the emergency department. So in my other role, I'm the Emergency Medical Services Medical Director. Every year during flu season, we see emergency department overcrowding. We see ambulance diversion. And I fear that that's what's going to be coming next for us here in Houston and Harris County as hospitals begin to fill up. As the judge pointed out, there is still capacity across the system. We know from SETRAC, we know that there's capacity across the system. But what that doesn't mean is that all hospitals have capacity. All hospitals don't fill up at the same rate. We're already hearing that the Harris Health hospitals, LBJ and Ben Taub in particular, are very full already. They may not be totally full, but they are very full, and there's vacancy in other hospitals. Your hospital may be one of the ones that's full, so we need to keep this in mind. The bottom line is that we don't want to get in the situation that we're in every flu season here with COVID. And as we've been hearing over and over again, it's at the point now, it's the time now where individuals, once again, can have an impact. If you take a look at this graph here, you'll see that from the far left going on, as a community, we were doing a great job. As a community, we were doing a great job. So it shows that it can work. We just need to do it again. Thank you.